Mr. Chairman, dear colleagues, my talk focuses on the relationship between air pollution and acute stroke unit hospitalization. It has been already demonstrated the relationship between cardiovascular events, mortality, and air pollution, but still confirmative studies are needed for cerebrovascular diseases. The study population I'm presenting to you is coming from one of the most urbanized and industrialized areas of my country, Lombardia, one of those with higher environmental problems and with problems with pollution. The study population comes from from the eastern borders of this area that are coming from one county, Mantova County. In the next slide, you can see a couple of pictures. The left one is including green and left spots in which you can see those urban areas with high levels of pollution above the thresholds of safety. In the right picture, the 9 areas suggested by the criteria of Baccarelli, published in 2008, where different geographical and environmental areas are divided to distinguish for specific features. We took into account for this classification. So this study, that's a preliminary time series study to assess the relationship between airborne pollutants and stroke unit hospitalization. That's a pilot study from the regional stroke unit network registry. I'm talking about an area in the plains of Pianura Padana, in the eastern borders of Lombardia, the county of Mantova, the city of Mantova, a nice medieval town crossed by a river. What about the study population? The county population is around 400,000 inhabitants, the city 47,000 inhabitants. We included 60 and 51 patients, the 45.7% of those admitted in the stroke unit. These are the pollutants that were recorded, as well as meteorological data. Data were given us from the local environmental agency, the ARPA agency. We excluded all those patients living outside the circle of 10 kilometers from the recording meteorological station. This was to have more valid data. Another part of subjects were excluded because living too close to high traffic crossroads or highways where the stagnation of pollutants may have overestimated the effects of pollution itself. The statistical analysis was done using a case crossover design and with 0 to 7 day lags, with day 0 as levels of air pollutants of the day of the index event. 2/3 of the patients studied suffered an ischemic stroke. Hypertension was the leading risk factors. In this other slide you can see the trends of some of these pollutants. Nothing happens except then for PM10, the small particulate. You can better see here the trend in the last week, rising from 46 to 48 milligrams per meter. An inversional proportion was found with humidity as expected. The rise of the powders was associated with a decrease. The logistic regression analysis found that both small artery disease and large artery disease were associated with increase of PM10 levels, and humidity was considered as protective for stroke unit hospitalization. Regarding mortality rates, we found an association between benzene levels and early mortality. This relationship was not anymore visible, taking into account 3-month mortality rates. In conclusion, gaseous air pollution is a potential risk factor for both small artery and large artery disease as presumed cause of the index event leading the patient to the hospital. Moreover, we found no relationship with cardiac conditions such as AF. I would like to thank all those that helped in this work, starting from the Department of Occupational Medicine of Perugia University, the POMA Hospital in Mantova, the Stroke Unit Network, and Dr. Baccarelli, who gave us his advice in the study design. Thank you for your attention.